Hi, welcome back to Rohrich Knows Podcast. This is Dr. RodRohrich. I'm a plastic surgeon in Dallas, Texas. We hear all the time about this new trend or fad and another, buccal fat removal. The deep plane facelift is so much better. We're taking ribs out to make waists narrower. I mean, is it real or is it not real? And is it safe or not? So I've asked a world-famous plastic surgeon, Dr. Bahman Guyuron from Cleveland, to come join me today to talk about some of these trends and fads in plastic surgery, especially in cosmetic surgery, and really with the mindset of, how do we assess these things, and are they safe, and how should we evaluate them? So, Dr. Guyuron, welcome. How are you?
I'm fine, Rod. How are you?
I'm awesome. So let's dissect some of these things. And you and I have been through a few of these fads and in all different aspects of plastic surgery, but especially most recently because of social media, it's been in cosmetic surgery. And so let's talk about the first one, of buccal fat. Not only is Dr. Guyuron a plastic surgeon, but he's also a craniofacial surgeon. So tell us about this fad about doing buccal fat on a lot of people. So when should people consider doing a buccal fat removal, and what is the harm of doing it when you shouldn't do it?
Yeah, that's a great question, Rod. What I do personally is manually reposition the soft tissues that I'm going to be repositioning in the operating room.
Okay.
After I do that, if I see a huge bulging soft tissue here.
Right here. Yeah, right here. Yep, right here. Yep.
Right, yeah, like close to the jaw. And that is if a person on whom I'm going to remove the buccal fat pad. How often they do that? Probably in 5% of the patients, 10% of the patients. Most of the time, you and I reposition the buccal fat pad and internally by repositioning the tissues and get advantage of creating more fullness in the area that we need. And we need to be careful about removal of buccal fat pad because it can cause a lot of hollowing. In fact, I just saw somebody who was very unhappy having had that operation done by somebody else. And I'm going to actually inject some fat in that area to replace the fat that was removed on this patient inappropriately. Most of our colleagues know what to do. But there are people that jump on, as you said it, jump on the bandwagon and do the things as a routine. There is no patient who needs everything as routine. We have to customize our rejuvenation technique.
I agree. And also, replacing the buccal fat is not a simple thing because it's the gliding fat pad between the superficial and deep compartment. It's not a simple thing to do. And it's like saying, oh, yeah, I can remove that filler. I mean, removing filler is another thing we'll just talk about briefly. But so I agree. So know before you go. And I like that. I agree. I hold it up, but also have them push their tongue to the top of their mouth and if they bulge. But most of the time, they don't need that. And then when they do, that's fine to do. So, well, let's just jump over to another thing that's a hot topic. And we're trying to just help you, the consumer, like the deep plane facelift. Now, it's another social media fad, and everybody says, oh, I discovered it, I did it. But, as you know, these are not new things. And we've been through all this with the deeper manipulation of the layers of the face, the SMAS, and going above and below it and going to the bone. And Bahman, tell us about your thoughts. I mean, we've been through all these techniques. So tell us about the deep plane. Is it new? Is it going to be so much better?
Absolutely not. We know that deep plane has been, in fact, the person who was the most ardent proponent of the plane is a friend of us from Dallas.
Yeah.
And, we know that repositioning of the deeper tissues may add to the longevity of what we do and improve the results. But we all do it differently. And what it means that, and unfortunately, the younger generation, they do that. They just jump on the bandwagon, and they want to do a deep plane on everybody. There are patients who need deep plane repositioning. Those who have not been smoking for 20, 30 years, but they used to smoke 20, 30 years ago. On those patients, skin circulation may not be as robust as somebody who never smoked. On those patients, I may consider repositioning of the skin and the deeper layers at the same time. But there's nothing new about it. It has been on for a long time. We all tighten the deeper layers in a variety of ways. Right. And those are our experience. And that's what the patients need to do. Look into the experience of the person. And some of the people do this, and again, immediately start doing different things because they haven't figured out what works, what doesn't work.
Exactly. And I talked to Sherelle Aston about this recently as well in New York, and he said exactly what you did, Dr. Guyuron. And basically, you got to individualize it to the patient, to their patients, their aging process and who they are. But no one person needs the same operation. And that's why there's different types of deep layer facelifts, like you talked about, the SMAS layer, extended SMAS, all these different things, SMASectomy, they work in selected patient populations. So I agree. So know before you go. And I think so much has been played up on that. And of course, then they say that, and how many times have we heard that this is the facelift that lasts forever? Nothing lasts forever. Death in taxes and probably a few other people we don't like, but so let's go on to another one that's really out there a lot, and that's thread lifts, and I see those a lot, and I know you do as well. I see patients all the time where they said, I had my thread lift done, and of course it lasted till the check cleared, which was less than 3 or 4 months or 3 or 4 weeks. So what is the dangers of that? I mean, certainly for those of us as surgeons, I don't like to operate on a thread lift patient. So tell us about, does that make sense to you?
Not really, because it has been demonstrated. In fact, some of the honest plastic surgeons who tried this have proven that it really doesn't work, and it does cause a lot of problems for us. It creates the scar tissues, you can damage the nerves on the process of suspension, and they all cut through the tissues. Right. So that's why they only last 3 to 6 months, maximum a year. And unfortunately, as you said again, people want to make a shortcut, but most of the time, shortcuts are not going to deliver the results that we want.
Right. No, I totally agree. And of course, when we do operate on them and do real surgery, it's another scar tissue plane because you got all of these things in there. The only thing that's been better is that they used to be permanent sutures. Now they're biodegradable. So what about, another hot topic is the lip lift. Everybody should have a lip lift. And of course, it's another operation, like you mentioned, I think in my hands, that in selected patients, it's a good thing to do. But my goodness, doing a lip lift on a 20-year-old? He says, is that a good idea?
Not really. I think one of the there are two dominant features of the face. One is the eyes, one is the mouth and lip relationship to the teeth. And when, unfortunately, there are patients that as they get older, and most patients as they get older, the lip may sag and cover the teeth. On those patients, the surgery is indicated. But you're talking about a 22-year-old patient, what happens is often what the center portion of the lip rises too much in relation to the corners of the mouth. And that's going to actually give us a sort of a rapid shape to the face. Most incidences is unattractive. Do I do it? Absolutely. And I do it in the right indication for the right patient. In fact, I sometimes say no because of exactly what I just said, because the patient has the high portion center of the lip. If you do a lip lift on the patient, you're going to create a V-shaped configuration to the lip that it is totally unattractive. So we really need to be careful about who's going to have a lip lift. In properly selected patient, it is a very gratifying procedure.
I agree, and it's a great adjunct for facial rejuvenation because as we age, everything gets longer and thinner, and it's a great operation, and you don't have to make it complicated. It really, if you reduce the size of the lip and just bring it up a little bit, and don't overcorrect it because it's hard to reverse that. So all wise words. So let's talk about one more thing, and then preservation rhinoplasty, another hot topic. I mean, rhinoplasty. You and I do lots of rhinoplasties, and preservation rhinoplasty, just like structural precision, they're both good operations. But, you know, we hear around the world that it's revolutionized rhinoplasty. It's and, you know, whenever I hear the word revolution, I think of some of the the things that we thought revolutionized it, and there's about a list of 20 of them in plastic surgery. And so tell us about preservation rhinoplasty. And first of all, it's probably a misnomer because you really have to understand rhinoplasty if you're going to do a preservation rhinoplasty. What do you think, Bahman?
Well, I agree with you. Actually, you're essentially destroying some of the normal portions of the nose to hide the flawed area of the nose, meaning the hump. So, is there a candidate for that operation? Perhaps, but frankly, again, this is one of those things that we have talked about, that individuals have never figured out to produce consistent and reliable outcomes. They're just trying different things, and it is not to say that is a wrong operation for a right patient. That could be the operation, but I think it is being overdone.
Right.
We just completed a study to show that many of these patients have multiple flaws, and they all are small flaws, but they are flaws. And the patients need to be careful. And I think that I'm going to tell you how you can avoid traps like this. Some of these are traps. Just listening to the patient, to the surgeon, and figuring and reading about the procedures and asking questions and making sure that you're educated, but not going with the fad and flow that it is a trend that is not really accurate. And again, experience is unmatched. There's nothing that replaces it. You should find somebody who is experienced that in doing whatever you're considering in any of the procedures that we talked about, and you're going to be safe.
Right. Wise words by an incredible plastic surgeon, Dr. Guyuron from Cleveland. Follow the facts, not the fad. And I think that's important. And so please give me your comments and thoughts. And I think this was a very empowering and enlightening session, Dr. Guyuron, because it talked about all these things that are so hot on social media today. And some are good. In fact, many of them in selected patients are good, but you have to individualize them and follow the experience and expertise of the surgeon, like Dr. Guyuron mentioned. So thank you again, Bahman, and I really always enjoy talking to you, and I learned so much from you, from your incredible wisdom and common sense. Thank you, Bahman.
Thank you.